Hello. Over the next few weeks, I'll be explaining how the way you breathe has a huge impact on how well you feel, how energetic you are, and how anxious or relaxed you become. I will show you not only how to enjoy greater well-being by well breathing, I want to explore the mechanisms by which we breathe and explain how to ensure these are working at maximum efficiency by cleansing your nasal passages and building what is called core stability.
Hello and welcome to the first workshop in this BOTAU self-help training program. We'll begin where the air you breathe starts and ends its own journey into and away from your lungs. That is, with the nose. Although human noses come in a wide variety of shapes and sizes, all serve the same two crucial functions. The first is to act as an air conditioning plant to purify, warm and moisten each inhaled breath on its way to the lungs, enabling oxygen to be absorbed more easily and efficiently. This is why it can be hard to catch your breath on a winter's day, and also why people from very cold, dry climates tend to have broad, flattened nostrils in order to provide a greater surface area for performing this task. By contrast, the noses of people from very dry regions of the world tend to be longer and narrower. If you study the inside of your nose in the mirror, you'll probably be able to see three bulges. These are known medically as conchae or turbinates. The word comes from the Latin for a child's top. These prominences agitate the incoming air so as to ensure it circulates over as wide an area as possible. As air is drawn over them from the outside, the turbinates grow cooler and drier before the passage of warm, moist air flowing in the opposite direction from the lungs on each exhaled breath restores them again. In addition to warming and moistening incoming air, the nose is our body's first line of defense against dust, smoke, pollen, bacteria, viruses, fungi, and any other potentially harmful material in the surrounding air. It protects us by acting somewhat like a flypaper whose sticky surface is used to trap the insects. As with a flypaper, the linings of your nasal passage can only do their work properly provided they are kept moist. A dry, congested nose is not only unpleasant and uncomfortable, it also creates a barrier to efficient breathing by reducing airflow to and from the lungs. What's more, somebody whose nose is chronically congested soon gets into the habit of breathing through their mouth. Because breathing in this way fails to warm and moisten the incoming air sufficiently, it means that oxygen cannot be so easily absorbed by the lungs. Now, since the effectiveness of BOTAU depends on the efficiency of how we breathe, clearly it is essential to remove any such barriers before embarking on the training procedures themselves. Even if your nose is currently clear and your sinuses feel free of congestion, it's still worthwhile mastering these techniques, since there's bound to come a time, either through an infection or as a result of working in a dust or dirt-laden atmosphere, that you will need to know how to free up your breathing. Now, the first thing is to drink sufficient water. Provided you're eating a mixed diet, including fruit and vegetables, a high proportion of it preferably fresh and raw, there's no need to drink the 8 glasses per day some authorities advise, since much of your hydration need will be satisfied by the water within those foodstuffs. When you do drink water, be sure to do so slowly by taking small sips, since gulping down a glass of water will stimulate your kidneys and cause you to lose much of what you've just drunk in a very short space of time. This is a process known medically as water diuresis. By ensuring your body's many cries for water are fully heeded each day, your nasal passages will remain moist, trapping many airborne infections and much pollution, while inhalations and exhalations will flow smoothly and freely. Dry air in combination with already overly thickened mucus can cause a crust within the nasal passages, resulting in discomfort and possibly inflammation. To ensure their nasal passages remain clean and healthy, an increasing number of health-conscious people now use a daily nasal wash. This involves pouring a small amount of water into one nostril and allowing it to flow out of the other one. Now, if you've ever accidentally sucked in water through your nose while swimming or taking a bath, this may seem like a crazy thing to do. You'll know only too well how disagreeable the experience can be. There is, however, a world of difference between a carefully applied nasal wash using water at body temperature and the accidental inhalation of chlorinated or chemically treated water. The traditional method of administering a nasal wash is known as Lengthening, or saline nasal irrigation. You'll sometimes see it abbreviated to SNI. This ancient technique originated in the Hatha Yoga tradition and has been employed for thousands of years and across many cultures. So now let's have a look at how Hatha Yoga Lengthening works. To demonstrate how to use Lengthening comfortably, safely and effectively, I would like you to meet Daniela Bryant, a qualified Hatha Yoga teacher who has been using and instructing students in the use of Lengthening for more than a decade.
I'm going to start off by mixing up the salt solution for Lengthening. I'm using 1/4 teaspoon measuring spoon, and I'm using sea salt, which is traditionally used in yoga. The solution I'm using is called an isotonic solution, which means it's the same level of saltiness that's in your body naturally. If you use any less salt, it will be very uncomfortable and it can actually cause long-term damage. So it's better to use this amount of salt. It's actually been researched recently that a hypertonic solution is more beneficial, which means a saltier solution than that found in the body. So you could use up to 3/4 teaspoon in this neti pot if you wanted to. So I'm using lukewarm water. It's about body temperature. I'll just give it a little stir. I stir it with my finger so I can feel that it's dissolved, and also testing the water temperature. Okay, I'm just going to put my head into position now. The position of your head will depend very much on the individual, and there's no right or wrong, so you need to trial and error this a little bit. You just place the neti pot into your upper nostril and just let it run out slowly, and while you're doing this, just relax and breathe through your mouth. When you finish then, you just need to empty each nostril in turn. Just do it gently at first, and then a little more. And then a little more. Okay, once you've completed both sides, there's a further drying process that needs to be completed now. First of all, I'm going to drain all my sinuses, so for this I need to hang my head upside down. So you do this however you feel comfortable, but I'll just show you how I do it. Okay, you need to do that for about 30 seconds. Then you will probably feel that you need to blow your nose again. Now the final part of the drying process, what I'm going to do is I'm going to breathe in and out rapidly 10 times to sort of blow dry the inside of my nostrils. If you try and get this breath coming from your tummy, that will give it a bit more force. You can repeat that if you want to, but that usually is enough. I'll just go through some of the problems that you may experience when you perform Jalanetti for the first time. One of the problems may be that the water will go down your throat. If this happens, what I tend to find helps is if you tilt your head sideways like this and push your forehead into the sink, into the basin, and look up at the ceiling, and that usually gets a good flow of the water. You can then, once it's flowing, then you can bring your head up to a more comfortable position. The other problem that some people, very rarely, but you know, it needs to be mentioned, is sometimes your ears may pop, and sometimes this may be quite uncomfortable. This is very rarely, it's happened to me once in 10 years, so it's very rare. But if this does happen, it's nothing to worry about. It's actually due to the involuntary opening and closing of the eustachian tubes, and sometimes a little bit of water may get in there. But it's nothing to worry about, as I say. You just need to wait for your body's warmth to evaporate the water, so it'll soon pass. It's best to perform Jalanetti every day. Try and incorporate it with your daily routine, such as cleaning your teeth. You clean your teeth, you wash your nose. A lot of people find it beneficial to do it in the morning as they rise, as it clears them from the night. And then in the evening, then before they go to bed. This helps greatly if you snore. It helps to reduce the snoring. However, if you find this a little too much to do, then just do it a few times a week. It's better to do it sometimes than not at all. If you are becoming lightheaded after you practice Jalanetti, then this could be due to one of three reasons. The first reason could be because you are affecting your ears when you wash your nose, because the ear, nose and throat are all connected. Then it could just throw you out of balance a little bit. The other reason is a lot of people, when they practice Jalanetti, afterwards they can't believe how clear they feel, so they take a deep breath, so you might have just had a little rush of oxygen to your head. Also, after the dry-in sequence, you may have just got up a bit too quickly, so just sit down until it passes. There's nothing to worry about.
Try Jalanetti for yourself, and I'm sure you'll be pleasantly surprised at how quickly this simple yet highly effective procedure becomes a normal and natural part of your daily healthcare routine. Now that you appreciate the crucial importance of your nose and respiratory system in maintaining a healthy lifestyle, we're ready to embark on the second workshop in this course. Here we shall be exploring the muscles of the abdomen and trunk, muscles on which effective, health-enhancing breathing crucially depend. Core stability refers to the strength of the muscles surrounding your stomach and the manner in which they interact with those of your trunk and lower extremities. Core stability is the essential starting point for all the exercises that follow in this program, allowing you to free up your breathing by safely stretching and strengthening the areas around your stomach. Core stability is also the key to balance, since our center of gravity is located directly behind the navel, opposite the third or fourth lumbar vertebra, and it is this point from which most of our movements are initiated. These include even mundane actions such as standing up from a seated position, getting out of bed, reaching beyond one's arm length, walking or running. One way of understanding the importance of core stability is to think of your body as a multi-linked chain comprising the feet, ankles, legs, knees, hips, arms, trunk, shoulders, wrists, hands. Delivering power through this chain, such as when you stoop to pick up a load, requires that each link is strong, especially at the trunk, the connecting point for our lower and upper body. Even one weak link in this chain means that the performance of the whole system is impaired, with power and efficiency being sacrificed. This is especially true when that weakest link is located, as it so often is, at the central connecting point. Using the incorrect muscles when transferring force from your arms and legs through your pelvic girdle to your spine, or when appropriate muscles are relatively weak, means your body will seek a way to compensate for the subsequent imbalance. This is usually achieved by using other muscles, some of which will be ill-suited to the demands of that particular movement. And again, this leads to a sacrifice of power and efficiency, combined with greater risk of such injuries as shoulder tendinitis and low back pain. By improving your core stability, you will help safeguard your spine, or if you're already suffering from a certain amount of low back pain, reduce or eliminate the current discomfort. In addition, and most importantly for this BOTAU program, core stability is essential for smooth, easy and efficient breathing. A strong yet flexible corset of muscles at the core of your body will help to ensure that the diaphragm can move powerfully and freely when drawing air into the lungs and then expelling it again. The reason why core stability yields such a wonderful range of benefits are easily appreciated if you consider the two different postures that result first from a weak and then from a strong girdle of muscles around our middle. In the first case, the individual is likely to be slumped somewhat forward, especially if their abdominal muscles are significantly stronger than those in their back. Surprisingly, this is often found among bodybuilders whose six-pack stomachs, while admired by some women and envied by some men, result in impaired breathing. Someone who has developed strong yet flexible muscles at their core and is at the correct weight for their height is far more likely to have an upright posture, and one that allows the air to flow smoothly into their lungs and to be able to use their powerful diaphragm to the full. It is equally important, however, to develop flexibility as well as strength, since flexible muscles are better able to lengthen and stretch in order to meet the demands placed on them. By developing greater core stability, therefore, you will be able to breathe far more efficiently and effectively, reduce your risk of injury, especially to your lower back, use all your muscles more efficiently, improve your balance, and enhance your posture. When performing the exercises you will hear described in a moment, please pay great attention to your technique, since the quality of any exercise is of far greater importance than the quantity. Rather than pushing yourself to complete a certain number of repetitions, focus instead on performing each exercise in as slow and as a controlled manner as possible. By doing so, you will ensure that only the specific muscles the particular exercise is designed to strengthen are being worked on. At the same time, a slow, focused attitude will help you achieve greater awareness of these core muscles. Before you start, however, a word of caution. While these exercises are easy to master and can be done with little effort, as is customary in any course involving physical exercise, I would ask you to seek medical advice before starting if you're in any doubt of your ability to undertake them safely and happily. This is likely to apply especially if you are overweight, pregnant, have high blood pressure or a heart condition, suffer from spinal problems such as severe low back pain, have recently had surgery, especially to your stomach or back. Should you be in any doubt about the suitability of these exercises, then please seek medical advice before proceeding. Remember, when carrying out the exercises, do so slowly and carefully, concentrating on getting each action as near perfect as possible. Take special care when standing up after the exercises are completed, because you may feel slightly giddy or breathless. If this happens while you're performing any of the exercises, then stop immediately and wait until you regain your breath and or your balance. So when you're ready, let's make a start on 6 exercises that will significantly enhance your core stability.
Lie on your back with your hands behind your head, legs bent to 45 degrees. Use a cycling motion to bring your right leg to your right elbow. Return your right leg to the starting position, then repeat with the left leg, bringing the left knee to the left elbow. Repeat 8 times for each leg. If at first you find it difficult to manage 8 repetitions for each leg, then do as many as you feel comfortable with and build to 8. That concludes the first exercise. Please pause for a few moments before moving on to the next exercise. Lie on your back with your knees bent, feet 1 hip width apart and parallel, your arms resting on your lower abdomen. You may find it more comfortable to rest your head on a small, flat, firm pillow. Start by relaxing your stomach muscles so that you can take a long, slow, deep breath. And as you exhale, flatten the small of your back against the floor. Arch the small of your back during the inhalation and count slowly to 5 as you do so. As you exhale, repeat the slow count to 5 as you lower and flatten your back against the floor once again. Repeat this maneuver 6 times. Now breathe in, slightly arching the small of your back, and then as you breathe out, allow the area around and below your navel to soften and hollow out towards the spine. It may help at first to imagine that you are lying in a hammock. Hold your muscles in this hollowed position and feel how your lower spine lengthens. Breathe in again and relax the muscles. Repeat this 5 times. That concludes the second core stability exercise. Pause for a few moments before proceeding to exercise 3. Lie flat on the floor with your knees bent, feet 1 hip width apart and parallel, with your arms resting on your lower abdomen, and take in a long, slow, deep breath. As you start slowly to exhale, hollow out your lower abdominal muscles by pulling your navel back towards your spine. Feel the muscles tightening and wrapping themselves around your middle like a corset. Now gently lengthen the lower part of your spine while keeping it pressed flat against the floor. Still slowly exhaling, slide your right leg along the floor and lift your right arm above your head so as to touch the floor behind you. Enjoy the feeling as you gently stretch from your fingertips to your toes, but be sure to keep your back flat against the floor and your navel pulled in towards the spine. Inhale slowly and deeply as you return your right arm and right leg to the starting position. Repeat these movements using your left arm and leg, stretching them as before. Repeat this exercise 5 times for each side of the body, making a total of 10 repetitions. Do not over-tighten your stomach muscles, rather try to hollow them out while keeping them loose. Your tailbone should remain flat on the floor as you gently stretch and lengthen the spine. Avoid allowing your back to arch as you stretch and lengthen your arms and legs. When pulling your navel in towards the spine, always simultaneously lengthen your spine. For an elongated spine supported by strong abdominals, these 2 actions must go hand in hand, and this is essential for good posture and good health. It is also important not to raise your bottom from the floor. Never push your spine down hard or tighten the muscles around your hips. That concludes core stability exercise 3. Start in a kneeling position and keeping your spine motionless, allow your abdominal muscles to sag toward the floor. Now tighten these muscles so as to hollow your stomach muscles. Focus your attention on pulling the tummy button up and in. Hold this tension for a slow count to 5, then release. Repeat this exercise 12 times. That concludes Core Stability Exercise 4. Once again, I suggest you pause for a moment before moving to exercise number 5. For this exercise, you will need a chair, stool, or similar support. Lie on your back and use the support to raise your legs into a 90-degree bend. Your legs should be bent at both the hips and the knees. Place your hands at your sides with the palms flat on the ground. Your head and neck should be held as straight as possible as you lift the front of your chest towards the ceiling. Make certain you are bending at the hips and not the neck. Imagine yourself being drawn upward by an invisible cord. As you raise your head and shoulders off the floor, slide your hands forward. Do not attempt to lift yourself more than a few inches and make certain you are only using your stomach muscles to pull yourself up. Inhale slowly and deeply as you begin to raise yourself. Hold this position for a count to 3, then slowly lower yourself again, exhaling as you do so. Repeat this exercise 5 times. That concludes Core Stability Exercise 5. Pause for a moment before moving to the final set of exercises. For the final exercise, we return to those vital muscles around your spine with an exercise that will help strengthen them even further. Lie face down with your arms stretched out straight in front of you, palms flat on the floor. Inhale slowly, and as you begin doing so, start walking your hands backwards towards you. At the same time, arch your spine slowly upwards until you can feel a gentle stretch in the lower back. Exhale slowly while holding this position for 5 seconds. Repeat this exercise 12 times. You can, if you wish, increase the number of repetitions for each exercise, provided of course that you never allow your technique to suffer as a result.
That concludes the 6 exercises that will help you develop and maintain the core stability on which optimal breath control depends. In workshop 3, you will learn how deep body breathing holds the key to enjoying a healthier and less stressful lifestyle.